Welcome to Senior Smart. Today, we're going to solve one of the biggest questions facing Americans turning 65. Should you choose Medicare Advantage or stick with Original Medicare? This decision affects your health, your wallet, and your peace of mind for years to come. If you're feeling overwhelmed, you're not alone. 64% of seniors report feeling confused about Medicare options. By the end of this video, you'll have complete clarity on which option is right for your specific situation. Let's start with the basics. Original Medicare has been around since 1965 and consists of two parts. Part A is hospital insurance. Part A covers hospital stays, skilled nursing facility care, hospice care, and some home health care. For most people, Part A is premium-free because you've already paid for it through payroll taxes during your working years. Here are the 2025 Part A costs you need to know. The hospital deductible is $1,676 per benefit period. For days 1 through 60, you pay $0 per day. For days 61 through 90, you pay $419 per day. For days 91 through 150, you pay $838 per day. Part B is medical insurance. Part B covers doctor visits, outpatient care, medical equipment, and preventive services. Part B requires a monthly premium. In 2025, the standard Part B premium is $185 per month. But this can be higher if your income exceeds certain thresholds. Here are the Part B costs for 2025. The annual deductible is $240. You'll pay 20% co-insurance of the Medicare-approved amount. There is no annual out-of-pocket maximum with Original Medicare. Now, let's talk about what Original Medicare does not cover. It does not cover prescription drugs, which means you need Part D. It does not cover dental care except for emergencies. It does not cover routine vision care or eye exams. It does not cover hearing aids. And it does not cover long-term care. Medicare Advantage, also called Part C, is an alternative way to get Medicare benefits. Instead of getting coverage directly from the government, you get it from a private insurance company that contracts with Medicare. Here's what's included with Medicare Advantage. You get everything Original Medicare covers, which is Parts A and B. It usually includes prescription drug coverage, which is Part D. It often includes extras like dental care, vision care, hearing aids, wellness programs, and transportation to medical appointments. Here's how Medicare Advantage works. Medicare pays the insurance company a set amount each month to cover your health care. The insurance company then provides your Medicare benefits, often with additional perks. Let me share some 2025 Medicare Advantage statistics with you. The average monthly premium is $18. 99% of plans include prescription drugs. 96% include dental coverage. 94% include vision coverage. However, Medicare Advantage plans typically have provider networks. This means you'll usually pay less when you use doctors and hospitals in your plan's network and more when you go out of network. Let's look at real-world cost scenarios to see how these options compare financially. First scenario: a healthy senior with low healthcare usage. With Original Medicare plus Medigap plus Part D, here's what you'll pay. Part B premium is $185 per month, which equals $2,220 per year. Medigap Plan G costs about $150 per month, which equals $1,800 per year. Part D prescription coverage costs about $40 per month, which equals $480 per year. Your total annual cost would be $4,500. With Medicare Advantage for the same healthy senior, the monthly premium averages $25 per month, which equals $300 per year. That's your total cost. For healthy seniors with minimal healthcare needs, Medicare Advantage can save over $4,000 annually. However, this changes dramatically if you need extensive care. Second scenario: a senior with chronic conditions. With Original Medicare plus Medigap, your annual premiums would be $4,500. With Medigap Plan G, you have minimal out-of-pocket costs. Your predictable annual cost is approximately $4,500 to $5,000. With Medicare Advantage for someone with chronic conditions, your annual premium is $300. Specialist copays range from $40 to $60 per visit. Hospital stays cost $350 per day. For days 1 through 4. The out-of-pocket maximum is $8,300. Your potential total cost ranges from $4,000 to $8,600. For seniors with chronic conditions requiring frequent medical care, Original Medicare with Medigap provides more predictable costs and greater financial protection. Let's examine prescription drug coverage. Medicare Advantage plans must provide drug coverage equivalent to Medicare Part D. But formularies and costs can vary significantly. For example, with brand-name medications, Medicare Advantage may have higher copays of $50 to $100. Part D standalone plans offer more plan options with potentially lower costs of $20 to $50. One of the most important factors many seniors overlook is access to their preferred doctors and hospitals. With Original Medicare, you have access to any doctor who accepts Medicare. And that's 95% of doctors. You need no referrals for specialists. You have freedom to go to any hospital in the United States. There are no network restrictions when traveling. With Medicare Advantage, you're limited to your plan's provider network. You may need referrals for specialist care. You'll pay higher costs for out-of-network care. You face network restrictions when traveling. Consider Sarah, age 68, who splits time between Florida and Michigan. With Original Medicare, she can see any Medicare doctor in both states. With Medicare Advantage, she'd need to find network providers in each location or pay higher out-of-network costs. Regarding specialist access, with Original Medicare, you have direct access to any specialist. With Medicare Advantage, you often need a primary care referral, and wait times can be longer. Now let's create a personalized decision framework. I'll walk you through key questions that will help determine your best option. Consider Medicare Advantage if you're generally healthy, with minimal healthcare needs. Consider it if you want lower monthly premiums. Consider it if you value extra benefits like dental and vision. Consider it if you're comfortable with network restrictions. Consider it if you don't travel frequently. Consider it if your preferred doctors are in-network. Consider Original Medicare plus Medigap if you have chronic health conditions. Consider it if you want predictable healthcare costs. Consider it if you travel frequently or split time between states. Consider it if you have specific doctors you want to keep. Consider it if you prefer fewer restrictions on care. Consider it if you can afford higher monthly premiums for peace of mind. Here's a financial decision tree to help you. Question 1. Can you afford $4,500 to $5,000 annually for healthcare? If yes, consider Original Medicare plus Medigap. If no, Medicare Advantage might be better. Question 2. Do you expect high medical expenses? If yes, Original Medicare provides better protection. If no, Medicare Advantage could save money. Question 3. Is keeping your current doctors important? If yes, check if they're in Medicare Advantage networks. If no, either option works. Before making your decision, here are 3 essential action steps. Step 1. Research your options. Visit Medicare.gov Plan Finder. Compare plans in your zip code. Check if your doctors accept Medicare Advantage plans. Step 2. Calculate total costs. Include premiums, deductibles, and copays. Factor in your prescription medications. Consider potential out-of-pocket maximums. Step 3. Understand enrollment timing. Initial enrollment is 3 months before to 3 months after turning 65. Annual open enrollment runs from October 15th through December 7th. Medicare Advantage open enrollment runs from January 1st through March 31st. Remember, this decision isn't permanent. You can change your mind during annual enrollment periods. However, switching from Medicare Advantage back to Original Medicare plus Medigap may require medical underwriting. If this guide helped clarify your Medicare options, please subscribe to Senior Smart for more in-depth senior living guides. How to choose the right Medigap policy. Thank you for watching Senior Smart, where we make smart choices simple.